Even if you have no personal or family history of depression, it's a really good idea to know the common signs and symptoms because depression is something that could happen to anybody.
I just had a baby. I feel tired and mentally drained all the time. Is it normal?
It is entirely normal to feel tired and drained once you've had a baby. I think society would often have us believe that having a baby automatically means that we as mothers are happy and healthy and glowing. But the truth is also that we've spent 9 months growing a whole new human being in our bodies, and that takes such a toll on us. It's entirely normal to feel tired and drained once the baby arrives.
What are the signs of postnatal depression?
First and foremost, there may be a persistent depression in the mood, meaning that the sad, low mood is something that persists throughout several days. So if the depressed mood lasts for more than 2 weeks, this is something that we might be concerned about, especially if the low mood lasts for almost the whole day, nearly every day, for the entire duration of the 2 weeks, because that's a significant time to be feeling depressed. Yet another symptom to look out for is lack of pleasure and enjoyment in things. So for example, a new mother might not be able to find enjoyment and happiness spending time with her baby. Some other symptoms of depression include disturbed sleep, appetite and energy, as well as differences in the way that the mother thinks about herself. For example, someone who is depressed may have very negative cognitions of how they are performing as a mother or about their general personalities or where their futures are headed. There tends to be a strong negativity and a sense of doom about things, that things are terrible, that they are awful and they will never get any better. Sometimes if these thoughts are very pronounced, the patient starts developing suicidal thoughts in which one actually makes some plans to end one's own life.
Where can I go for support?
In KKH, we provide screening for depression for both antenatal and postnatal patients. The screening consists of a simple questionnaire which is administered to the patient, and the patient is able to look at the questions and fill in the answer that most applies to them. Our screening program for pregnant patients is called PREM, and it's usually given when the patient is in the 2nd trimester. A very similar procedure is done for our postnatal patients under the program called PNDIP. In addition to the screening programs, patients can also approach their doctors or their nurses on a one-to-one basis whenever they feel comfortable to talk about their emotions. If you need more information about maternal depression, please do reach out to your doctors. In the same way that it takes a village to raise a child, you are not alone in your motherhood journey. Motherhood is difficult. It's tiring, it's exhausting, it's demanding, it's 24/7, and there are no breaks. So it is hard and you shouldn't be doing it alone. So if you have trouble with your mood, there is no shame in suffering, there is no shame in seeking help, because we recognize maternal depression as a real condition. Treatments are available, and the earlier you seek help for depression, the easier it is to treat and the faster you could get well.